Just 2 weeks into the semester, and more than 650 students at Iowa State University have tested positive for coronavirus. The outbreak is now spreading into the surrounding county. NBC News reporter Vaughn Hillyard joins us now from Ames, Iowa. Vaughn, good to see you. The infection rate on campus has more than doubled in just the past week. What exactly is happening there?
Exactly. If you just look at the percent positive rate, let's just go to the data here. The percent positive rate on the Iowa State campus here in Ames, Iowa, the very first week, it was 13%, Joe. The second week, it jumped all the way up to 28% positive rate, which is strikingly high. And that is where there are those real serious question marks about what way can the school year go forward. I just want to introduce to you Blake McGill. He's a sophomore here at the university, and I think you'll see exactly where he's at. He's in a quarantine dorm where he will have to be spending 10 days because he was in close proximity to somebody who had COVID here on campus. Take a listen.
I'd say classes are going really well. Iowa State's done a good job of making things very accessible for students that are either forced to or prefer to go full online. Moving forward, I think they have a lot of help opportunities and resources for us, for those that are doing all the online activity. And so I would really hope to see that continue for the rest of the semester so that we can all stay here and still get a taste of what normal college is usually like rather than send us all home again.
Blake was obviously a good sport with us there on day number 5 in quarantine, and the work of our great camera and audio team of Mike and Tim there, having the chance to talk to him. But what you're seeing right now is there's about 100 students like Blake that are currently in isolation or in quarantine, which is making this difficult for the university. There's already been more than 650 cases here on campus, and there is concern about to the extent to which it begins to percolate and goes outside of this campus. Ames is a college town, but if you look across Story County, Iowa here, where Ames is at, it is now a hot spot here in the country. Iowa has the highest per capita rate of cases right now, just behind South Dakota and North Dakota, Joe.
Yeah, and Vaughn, you mentioned that. We know universities are not in a bubble. Students work in the community, people in the community work at the college. So what is the worry in the community about this spreading beyond the college?
If anybody's gone around a college campus before, usually socializing is at the forefront, along with, of course, the educational side of things. And that's what makes it strikingly difficult, especially if you take into account freshmen that are coming onto campus. And I want to introduce you live to one of those right now, if we could. Gwen Costello, you're an animal science major. And tell me, you're a freshman. You moved down here from Wisconsin.
Yes.
What happened on your very first day?
I moved in on the 4th, and I got tested over at the Dateline Health Center, and I got notified that I tested positive for COVID-19 without having any contact with anyone who had been possibly even exposed to it.
Very first day, then what happened?
I got moved from Friley across campus to Linden, which is right behind us.
Which is right behind us over there.
Yes.
You were in isolation?
Yes.
How many days?
From the 4th to the 15th, so for 10 days.
You had a lot to think about in your first week and a half.
Yeah.
After that, you were released from isolation. Then what did you see on campus here?
Lots of partying and people not conforming to the social distancing rules that have been put in place by not only the campus but also obviously the CDC. And so when all of the cases began to spike, it tended to be because of the parties that those people were going to.
That had to have made you almost want to scream.
It was frustrating. At the same time, though, a lot of us are socially deprived teenagers after not having a senior year for us who were freshmen this year. And then to put us in a socially enriched zone and tell us to not socialize is pretty difficult, to say the least.
My sympathies are with you. What is your message now to students? And is it possible to have the rest of the school year go on in the way that it's attempted to go in this first month?
My message is wear a mask, because it's easy to put a mask on. It's one of the first things I do in the morning when I leave class, because I have very early classes. And so if you put a mask on, you're saving yourself and anyone else.
Have you seen a difference?
Yes. Well, yeah. I've seen that when people are wearing masks outside, it makes me personally feel safer, even though I can't get it for at least the 90-day period because I tested positive, so I have the antibodies. It makes me feel safer to be wearing a mask because in case I come into close contact with somebody who has it again, or I might possibly still have any symptoms, which I don't. But if anything were to happen in the future, it makes me feel safer, and it makes the people that I'm with also feel safer, I believe.
Gwen, thank you very much. Good luck to you.
Thank
Hopefully
you.
the next couple of years are a little bit better than the start of this one here. Animal science major, freshman. Not only is it the educational side of things for these students, but these universities, Joe, the universities and government officials will tell you as well that the long-term concern here is also the financing of these educational institutions here. You know, that's why initially the Iowa State is having their first football game this Saturday, and they announced that 25,000 fans were going to be allowed in. But after much pushback, as Story County is now a hotspot, they've gone against that initial decision, and it's the athletic department that is saying that the university now finds itself in a $30 million deficit because of it. These are the tough conversations that not only students, as well as faculty, as well as these university officials are now grappling with.
Yeah, this pandemic is hitting college communities very hard. Vaughn, while we have you, I do want to ask you, is Iowa's governor or any state officials doing or saying anything about this outbreak that you're seeing around the university?
Governor Kim Reynolds, a Republican here, has been insistent that she is not going to implement a statewide mask mandate, but also she is not going to allow localities to enforce mask mandates, which has led to a lot of local officials that have been frustrated by that decision. Just this morning, I was talking with Dr. John Passion, who is the chair of the Story County Board of Health, and he said that localities, especially when a place like Story County now finds itself to be a hotspot, should have that ability to make their own decisions within their jurisdiction. And one of those is a mask mandate, which the governor right now has been resistant to allowing these localities to do.
All right, Vaughn Hillyard, thank you so much.
Thanks, Joe.
Labor Day, of course, is the unofficial end of summer. There is a lot of worry, though, that what happens this weekend and what happens today could impact the entire fall, at least when it comes to the coronavirus pandemic. So we want to bring in our doctor to ask a few questions about this weekend and what's going to happen moving forward. Dr. Shoshana Ungerleider joins us now. She's an internal medicine physician at California Pacific Medical Center. Doctor, thank you so much for having us. We know Dr. Fauci has expressed concerns about what people might do this weekend. We know we saw with Memorial Day weekend and even the 4th of July, people had gatherings then, and then in the weeks that followed, we saw the virus spread. What are your worries about Labor Day weekend?
Well, Joe, we're all concerned that we'll see these same spikes after this holiday weekend. And really that impacts everyone's ability to allow our children to go back to school safely, to return to work. You know, I want to point out that at Memorial Day, we had 20,000 cases per day. Now we're at about 40,000 cases per day. So our individual behavior this weekend and beyond really matters. You know, that said, the value of social interaction, as we know, is significant and really impacts our well-being. So, you know, if you do feel strongly that you want to gather this weekend, it should really depend on your individual situation and that of your family and your tolerance for risk. Don't forget, it takes just one person to spread COVID to many people, and it can actually be someone in your own family. So doing things like staying outdoors, wearing masks, maintaining social distance when you're not eating and drinking around other people is really the right thing to do. And the bottom line is that there's no 100% risk-free way to get together with folks. And remember that, you know, if you're spending time around anyone that's high risk, meaning that they have underlying health conditions or they're over 60, their risk is much greater for illness and death from COVID.
We know how important it is to try to get the pandemic under control heading into the fall after seeing so many spikes, especially in the South and West this summer. Based on what you're seeing right now, looking around the country, where are we at and how much is or is not the coronavirus under control?
Well, Joe, we're now in the 7th month of the COVID pandemic, and there continues to be no national strategy out of the White House. We still have COVID cases rising in 22 states. We heard just now what's going on in Iowa. You know, as we head into flu season, this is extremely concerning. I mean, listen, if we had easily accessible, fast testing, if nearly everyone was wearing a mask and there were policies in place and messaging to support this, we really could get much of our lives back while we wait for a COVID vaccine. The White House should not be advocating for schools to be opening no matter what, or for bars and restaurants and other businesses to just resume regular services. This is driving many more COVID cases and preventable deaths. I really think we can do so much better than this as a nation, and we really should be.
For months now, we have been talking about testing. In some places, it can be hard to get a test. Others who get a test are waiting 10, 14 days to get the results, which essentially makes contact tracing useless. As far as you can tell, where do things stand now as far as being able to get a test and get those results back quickly?
Joe, it's dependent on where you live. So we're still not in a great place nationwide in terms of testing, unfortunately. There are not enough tests being done and delays in results. We have seen these rapid tests emerge, and this is a step in the right direction. They're fast. They're relatively good tests. They're cheap. We need now to see the political will to take this very seriously. We need to have the capacity to trace and to isolate people if they test positive. And we need to test everyone, not just people who are symptomatic, since we know somewhere around 40 to 50% of people are asymptomatic with COVID. So if we can do these things and have the capacity to do, honestly, billions of tests in this country, we can make a big difference.
Dr. Ungerleider, thank you so much for joining us. We do appreciate it.
Thank you for having me.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.